Hello, 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 Vivalifers. This is Dr. Kelly OMD, your board certified OBGYN and healthcare executive, here to help you live your healthiest and wealthiest life. And the way that we do that is spiritually, physically, financially, mentally, and emotionally. We bring the top notch subject matter experts from around the world to these webinars, as well as we have a podcast, as well as Vivalife experiences. We're going to drop the link in the chat for you so that you can find out more about us. But tonight is not about me. It is about our special guest. Our special guest, Dr. Derek Robinson, who is a board certified emergency management physician, but even more importantly, he is also a healthcare executive in the C-suite, just like me. Dr. Derek is here tonight to tell us about his experience and his new book, The Improbable MD. Dr. Derek, take it away.
Dr. Kelly, thank you so much for having me today. It's a pleasure to be here with you and all the Vivalifers on Ask Dr. Kelly MD. It's a really special virtual conversation space that's committed to education, encouragement, and inspiring. I want all the Vivalifers to know that I consider it a privilege to be here with you this evening and have an opportunity to share and support you in your journey to greater health, as well as your journey and interest in healthcare, and hopefully to be wind in your sails in whatever direction you're charted. As Dr. Kelly noted, I am Dr. Derek Robinson, the author of the book Improbable MD, From the Bayou to the Boardroom. And this book is available on Amazon, Kindle, Apple, anywhere that you get books. And I had the privilege of recording last year the audiobook. So that's available on Audible as well. So I encourage you all to check that out, narrated by yours truly. I am incredibly blessed to have an opportunity, first and foremost, every day to be a husband, a father, a son, and a brother. And those things really keep me grounded, very grounded. But also honored to be a physician, an emergency medicine physician. I'm a doctor in the ER, and that has given me some really awesome opportunities to be there for individuals at really incredible times in their lives. But I'll also say it's a journey that has imparted incredible humility to me as well. You recognize the frailty of life and the frailty of what we can offer and do, and the importance of having a higher power. And as Kelly noted, I also had the privilege of being a healthcare executive, and I've had a chance to work across a number of different spaces, from government to not-for-profit organizations, as well as major corporations. I've also had the privilege of sitting on a number of nonprofit boards, as well as university and corporate boards. And those things have given me a really, really great perspective, I think, upon which to look at healthcare, to look at society, to understand some of our successes and challenges and opportunities for the future. But I want to be clear in saying that these titles kind of represent more of the glory. And I think it's important to understand the story and the journey. I think often these titles can kind of put us out of reach for individuals who are looking to get inspiration. And so part of the reason why I took time to write Improbable MD is because I wanted to sort of take off the white coat for a little while, because the white coat kind of hides your scars. You can't see those scars, right? You can't see the challenges that you face. You can't really see the fear, the doubt, the insecurity, the setbacks that you've experienced over time, the helping hands that have come along the way, the important turning points and inflection points in the career. And so Improbable MD really takes you through that journey. And I'm surprised I got to 20 chapters. So 20 chapters in the book really celebrating the importance of love, faith, and hope as a really important foundation for my journey, which took many different turns. When I think about my journey, and Kelly, even when I look at you, you're an Improbable MD as well, as is Dr. Ellis and many others that are on the call today. As I look back on the journey, I think about, being the great-grandson of individuals who were enslaved in Louisiana, being the grandson of a Louisiana sharecropper, being the son of a single mom, and being raised in a little town, Shreveport, Louisiana, and the distance and the turns and twists to get where I am today, it seems pretty improbable. But I think what's more important is ensuring that there are many more individuals who come from those backgrounds and those circumstances have the opportunity to have similar successes and similar experiences. And so when I think about our conversation that we'll have today, when I think about what readers will take from the book, it really is that journey, not only in terms of telling the story, but also how do we ensure we let a ladder up for other individuals who seek to really tackle their dreams and to really run forward and aspire to do things that maybe many folks around them haven't done. So there are three big things that I want to talk about in a few minutes that we have here today. The first is I want to dispel the notion that people achieve success or they make it on their own. And my vantage point, in my experience, making it high achievement success is a team sport. And that means that there are individuals along the way who help give you encouragement. There are individuals along the way who share with you their mistakes, their failures or challenges, so that you can learn from those and not have to learn it yourself. They also help save you from some lessons that you could learn really well on your own, but they're so disruptive. They're such toxic lessons to where they would impair you from ever achieving your goals. And so I always caution individuals, especially as they are working through some of their struggles and trials and really trying to gain the momentum, is just to remember it's a team sport. Reach out for help. Share your concerns. Be vulnerable. Reach out to those individuals who have traveled in a similar journey so that you can get that encouragement along the way, and never feel that you are on your own and that you have the entire responsibility to get there. That's something that we know because we've seen that and we've experienced and benefited from it. The second thing that I want to share with you is that as you think about some of the struggles and disappointments and failures that you may experience, I want you to know that those aren't always for you. They're not a consequence of you doing something bad or you being a flawed individual. Sometimes you go through these experiences because these are for you to help someone else. I'll break it down a little bit. Giving bad news is one of the hardest things that I do as a physician. It never gets old. It requires a lot of time and energy and empathy. But imagine someone delivering you news that you will never forget, the way they said it, what they said, and how you felt when they said it, if they've never been through anything before, right? So when you think about, our desire to grow and achieve, certain things in our careers, achieve certain levels, those come with responsibilities, right? And so there are things that you may experience along the way to ensure that when you get to where you believe you're called to serve, you can actually serve in all aspects of that job. When I think about my role in managing leaders and mentoring executives in the corporate space, you have to have taken a couple of arrows in the chest to be able to help coach someone through dealing with very difficult management experiences or making very difficult business experiences, business decisions, checks all the boxes and makes things easy. That comes through the experience that you have along the way. And so try not to get too caught up in those struggles and disappointments when you're in them, because often they are lessons to help prepare you for what's around the corner, not for you, but maybe for someone that you're in their path and you're the individual that's going to help carry them along the way. And the third thing I want to share is that each of you has something really special to offer to humanity. And I would encourage you to determine what that is and to pursue it vigorously. When we talk about our careers, usually it's a destination. You have an opportunity to get there and work, but I want you to think beyond that and think broader. For me, being a physician has been an incredible privilege, but part of my mission, part of my ministry, part of my purpose has really been to help ensure that I am mentoring and helping young people and older people as they move through different aspects of their life, whether it's education, career, or health. And that's one of the big things that wakes me up every morning, that gets me excited in the evenings after work. And so I would encourage you all to determine what that opportunity to serve is, that opportunity to give back to folks in your community, folks across the nation and around the globe, especially through platforms like this, and pursue it vigorously and don't give up on it. So I've got a book with 20 chapters in it, so I definitely won't try to summarize that. But Dr. Kelly O, it's great to reconnect with you, and I'm looking forward to our conversation today.
Well, thank you, thank you, thank you for that great intro and, what you said, those top 3 things. So I'm going to let everybody know, Viva Lifers, please go ahead and get your questions ready. If you are in the inner circle of Viva Life, you get to get your questions answered first. And I see a couple of people on here that always have great questions. So I know that they will go ahead and put them in the chat for us. But I do want to give y'all a little bit of background. Dr. Derek and I actually went to college together. He was one of the first people I met at XU, so Xavier University, and we did it at the same time. So he is one of the first people I actually met when I got to Xavier University of Louisiana. And when he's talking about being the improbable MD, we are both, when I read your book, I was like, the first 100 pages, I was like, did I write this? This seems like my life. And I did not know it. And one of the wonderful things about Dr. Derek was we actually started a program called X-Men, and it was Xavier Men Against Rape. And Dr. Derek and I, we actually started this program together. We actually had vigils together because unfortunately, this is something that truly does happen on college campuses, especially. And both of our careers took off, and we met up again after we graduated when he came to Chicago to interview for a position. So I'm just so excited and so proud to have Dr. Derek on here and watching his career grow. But you said something that really struck me just now. Success is a team sport, and I know your family is a big team of swimmers. So can you tell us about, that team sport aspect? Because a lot of times it seems like a dog eat dog world, and we know that's not how medicine is at all. We have to work together, but just expound upon that a little bit more for me.
Yeah, absolutely. I mean, there are so many things that we're going to encounter on our journey. You really can't possibly know all of the things that are necessary to get where you're going. And I'll just reflect even on just getting through medical school, right? We talked about the individuals who study alone versus the individuals who study in a group. It's important to do your work, do your part, put in your time to do what you need to do to prepare. But geez, if you don't get with other folks to understand what they heard when they were in that class, what notes they took, and, you go into an exam thinking that you had everything together, and the exam results don't turn out as well as you thought they would. And so group studying is something that is very important. We talked a little bit about sports. Yeah, both of my kids are competitive swimmers, and certainly, we spend a lot of time talking about, technique, paying attention to details, but also, pushing each other, challenging the folks that you are training with to help you be your best. Iron sharpens iron, and we get there together. And that might mean that, hey, you're not the best in a certain race. Maybe you prefer an event that's shorter, but you get in with one of your boys and you race the first half of it and push him over the hump, so that then he's got the momentum he needs to swim the rest of that race. And that's how we work together to ensure that we're winning. So yeah, success is definitely a team sport, not something that you achieve on your own.
True that. And when I'm in meetings and even on the labor and delivery, as I'm an OBGYN, I'm always talking about basketball and how, I was a point guard or off guard on my basketball team. And everybody knows that Kelly talks about how, if you have the open shot, if you're the one that's able to get the rebound and you're trying to get that 2-pointer, that 3-pointer, and you don't have the position, then you need to pass it. And when you do that, everybody gets to play, and you get to diversity of thought, you get diversity of experience. And in the end, that type of teamwork wins championship. And in our lives, that type of teamwork saves lives.
It does save lives. And I tell folks that in the ER all the time. A lot of folks think of the doctor as being like, the big person making all the decisions, but you don't have the power to do a whole lot. You've got to bring a team together, right? Who's going to give the medications? Who's going to take the patient to radiology and back? Who's drawing blood? Who's ensuring that the room is clean? There are a lot of different pieces of a team that are necessary to provide good care to patients. That means everybody's valuable. Everybody deserves respect and to be spoken to appropriately. And we got to ensure that we're all doing the very best for the patient. Team sport.
That's right. I said, hey, we are here to deliver high quality, safe, equitable, evidence-based and inclusive care. And the way that we do that is earn expertise and listening to our partners as we do this. All right, we actually have a question from Tiffany. You mentioned giving someone a ladder up, which is it's so important. You had the privilege of going to 2 HBCUs, but are you worried about how the rollback of affirmative action will affect future students applying to medical schools that are predominantly white?
That is a great question. And I think the concern regarding opportunity for students of color to get into medicine is a great concern that I have now. And I think it's been a great concern for folks over the decades. And I think, there's a multi-pronged approach underway that's, really aimed at helping limit those ladders to success. And that's why it's important for us to ensure that we are active and engaged at all levels. That includes ensuring that we're helping educate our young people in primary and secondary education experiences, and also ensuring that we are working with medical schools and accrediting organizations and others to ensure that the value that our young people bring to medicine is something that remains front and center, and that we're really also focused in on addressing some of the big challenges that we face in healthcare delivery. We've got huge inequities in terms of how care is delivered to patients, and that's leading to a lot of the disparities that we've seen and inequities in health outcomes over the years. How do we improve that? One of the major pillars to improving that, in my view, is ensuring that we have a diverse and inclusive healthcare workforce. You think about Black men, for example, we have some of the worst healthcare outcomes and health outcomes of any subpopulation within the United States, but we're also significantly underrepresented in the healthcare workforce. So what does it mean for me to be able to get advice from a physician who shares my life journey, that may be able to convince me to make some decisions that may be in my best health interest, that maybe I distrust the advice of others because of my lived experiences? Those are important things that matter. And so this is something that we have to continue to keep our shoulders behind, continue to push forward to ensure that there's representation across all subcategories in healthcare. I would encourage people not to be discouraged and not to be distracted. Are you going to have decisions like what we've seen at the Supreme Court? Yes. Are you going to have people who are going to be dismissive of what some applicants have to offer? Yes. But we have to continue to press forward. It's Black History Month, so we got many examples of folks who can teach us how to press forward.
That is so true. And thank you, Tiffany, for that question. And thank you, Dr. Derrick, for that answer. That pushing forward, and I think that's something we definitely learned being in school together. Like, we literally helped each other get advance in many areas of our lives. And either in this health equity work, we see so many people that we know, our colleagues, our friends, our family members, that are doing the same thing for advancement. One of the things that we talk about in our nonprofit, Logan Heights CDC, is from cradle to career. And it literally is getting these babies out of the womb. Hello, Dr. Obi.
That's you.
Right? And getting them in these preschools, these schools, these STEAM programs, so that they can truly have a flourishing career and make a difference in their communities, their country, and around the world. All right, we have another question. Thank you, Dr. Baker's on. Can you speak on the role of your mentorship in your career? What advice would you give pre-meds and med students about finding mentors? And how do you make the most out of mentor-mentee relationships?
Those are really good questions here. Power of mentoring, the best way I can describe it is that what mentors did for me was they placed a lens in front of my eyes that really changed the way that I saw my future and the way that I saw opportunities. For me, that was liberating and really inspiring. And so I would certainly encourage our young people to obtain mentors. When it comes to choosing a mentor, you want to ensure that you've got some diversity within your mentors, right? So you may have a man mentor, you may have a woman mentor, you may have a mentor that is in a Black and brown community, you may have a mentor who is white or Hispanic or of another race and ethnicity. You want to have folks who have lived perhaps in different parts of the country and maybe work in different industries. And so think about kind of the diversity of individuals that you might put together. How do you get a mentor? You ask. I have found that individuals who are successful are generally accessible, but you just have to be willing to reach out and ask for help. And in terms of how you maintain your relationship, the thing that I found to be most powerful and most enduring is communication, effective communication. You don't want to reach out to the mentor when you need something. So the only time they hear from you is when you need a letter of recommendation or something like that. That's probably not a very strong mentoring relationship. We talk about mentoring as you reach certain milestones throughout the year. You reach out, touch base. Hey, hope things are going well with you. Here's an update. Here are where things stand. Or, hey, need some questions answered on a particular area. Do you have any experience here? Or, I'm having a major challenge. Is this something that you think you can help me with? And know that different mentors will have different levels of availability. And so you want to kind of gauge what the other obligations or responsibilities that your mentor has, so that then you can kind of tailor your questions, your request to the right mentor at the right time. I hope that answered the question.
Well, if it didn't for her, which I'm sure it sure did for me. And so many other of us on here. I mean, that's one of the things we have opened up this forum to everyone. You know, as a lot of people think, oh, there's a physician coming on, I only want to hear what they have to say if it has to do with this or it has to do with that. We have medical students, we have physicians, we have, you know, nurses, we have teachers, we have non-healthcare people that are listening to this because there's so much to gain from it, whatever career field that you're in, and as well as an entrepreneur. Mentorship, you need mentorship. Now they're calling them coaches, however you want to move along with that. Mentorship, coaches, as well as sponsors and advocates. So those are big things, because there's people that are sitting at the table that may not be able to actually be on the phone and talk to you all the time, but they see the work that you're doing. And then when they see the work that you're doing, they get to meet you. And when they go in that room, they're talking about the great work you're doing. And that's typically how you get your next promotion, your next job, your next opportunity. So mentorship, it is not just that. It's mentorship, advocacy, and sponsorship. So we love that. And thank you for that question and that answer as well. So I cannot walk away from this and not say, okay, we said it's Black History Month, so we're very grateful to have Black doctors on. But it is also February is Heart Health Month. And you, an emergency room physician, emergency medicine physician, I apologize for getting that wrong. Emergency medicine physician, what are the couple of 1 or 2 diseases that you see people walk into with the emergency room that we could probably help prevent by doing some simple things?
That is a great question. We know that February is Heart Health Month, and we know that heart disease is a leading killer of Americans and a leading killer in the Black community. And there are a couple of things I think that are important. One is to say that our diet and what we eat is so important. You've heard this phrase sometimes that food is medicine. And so when you think about the things that you eat, and I'm sure Dr. Kellyo has tons of advice that you all can just pay attention to, but it's so true. Like 80% of the things that influence your health are outside of what we do in medicine, and food is a major one. So think about, you know, eating foods that are low in sodium, low in cholesterol, foods that are not ultra processed, reducing the amount of meat that you eat, increasing the number of whole grains and vegetables. Those things are really, really important. Physical activity. Physical activity is extremely important for heart health. You know, getting your heart up, 30 minutes recommended a day. Whether you get that in 10-minute chunks, 5-minute chunks, you know, but figure out how to stay active. What happens when we don't do these things? So when we're not eating well and we're not physically active, then we end up dealing with obesity, right? We know that obesity is a major driver of many heart conditions and other risk factors like diabetes and hypertension. And to kind of wrap this up, I will say that in our community, often we don't have just one of these. We might have all of these: poor dietary habits, inactive, obesity, diabetes, high blood pressure. And that makes us a setup for heart attacks, strokes, and other complications.
And you nailed it, of course, because this is what you do on a regular basis. I absolutely love it. And thank you so much for shouting out the Vivalife 5, which is a part of our Vivalife program as well. So we have 3 minutes left. I'm not sure if anybody else has any other questions, but I want to give Dr. Derek the opportunity to tell us how to get in touch with him on Instagram, as well as how to buy his book.
Thank you so much. I am on IG. My IG handle is DRobMD. DROBMD. Definitely follow me on Instagram, putting out some material to stay connected and help educate and inspire you all. So I'd love to connect with you. As Kelly shared earlier, it's a copy of my book, Improbable MD. You can get it wherever you get your books at. I also have a website, drderekrobinson.com, and I'm on LinkedIn as well. So we'd love to stay connected with this group. And I certainly hope that the conversation that we've had today, you found to be inspiring and educational to you. And I hope that you all feel encouraged, regardless of what challenges you may be facing individually. Know that these aren't always challenges that are just for you, but sometimes they're for you to help inspire and help bring someone else along on their journey as well. And I would love to hear your feedback after you get a chance to read the book as well. And Dr. Kelly, thank you for sharing your feedback as well. It makes me feel really good. You know, writing a book it's really vulnerable because you feel like you're walking around in your open book. But I think, again, that's the benefit of sharing your journey with others so that they can relate and see the path that you followed and be inspired to blaze their path forward.
Absolutely, absolutely. So we also have one of our mentors on here, Dr. John Ellis, who is going to be our next guest on next Monday, 7:30 p.m. Eastern Time. So make sure you register for that. Dr. Derek Robinson, I'm telling you, reading your book gave me even more respect and love for you. So I'm just so proud to be a part of your circle. And thank you so much. All right, y'all. You know, I'm Dr. Kelly OMD, board certified OBGYN and healthcare executive. And you're on Ask Dr. Kelly OMD. If you want to reach out on Instagram at DRKELLYOMD, as well as Viva Life Health Hub. And my website is drkellyomd.com. Have a wonderful evening. And don't forget to do what? Viva Life. All right. Thank you for being a part of the Viva Life experience. I'm Dr. Kelly MD, board certified OBGYN and healthcare executive. If you like what you heard, then please go ahead and like, share, and subscribe. The reason why is because we are trying to educate, encourage, and inspire 1 million people to live their healthiest and wealthiest life. And this is what we're bringing you. We're bringing you educational videos. We're bringing you podcasts. We are bringing you webinars with subject matter experts, including myself, about the topics that affect you the most. So go ahead, like, subscribe, and share. We are everywhere. Have a wonderful day. Viva Life.